Okay.
This meeting is being recorded.
Good evening, everyone. Today is Thursday, March 23rd, 2023, and we're getting ready and we're on for our Zoom class. So I know a lot of others might be joining, and if not, this is being recorded for you to review, at a later time. Remember that your exam is tomorrow. You will have your exam on chapters 3 and 4 on tomorrow. Your exam is due by Sunday, 11:55 p.m. Remember, your exam is always due on Sunday, 11:55 p.m. unless it falls on the day that it's the end of the module. If it falls on a day when it's the end and that's the last day of the module, then you have to complete that exam at that time. Other than that, all exams are due on Sunday. It's open on the day that it's actually due, but you have until Sunday to complete your exam. So you have chapters 3 and 4 exam on tomorrow, but you have until Sunday. Other announcements before we get started. Remember that your daily assignments are due every night by 11:55 p.m. and your labs are due by Sunday. If you're doing your labs and when you're doing your labs in SimChart, I'm not able to see that lab. I'm not able to see it, but I can see it in the SimChart simulation. So excuse me 1 minute, that's a student that's calling. Sorry about that. They hung up as soon as I answered, but it's fine. There was one probably can't get in the system. So just always remember that you have that time to be able to get into your SimChart. So I'm going to be assigning more labs because believe it or not, I don't want you all to be scared, but there are like 99 labs that you all have to complete. But some of them are very short. It might just be putting the name on that chart. And then you have that short quiz at the back of it. But if you're feeling that the grade is not being checked at that time, you can take a picture of what you're submitting in your SimChart and you can upload that picture. Because with the SimCharting, I go in every night, but it might not get a grade because in order for that grade to be posted, you have to take the quiz. So if you're not taking that quiz at the end of that system, at the end of that module, and even at the end of that assignment, I can't grade it. So a lot of you all are going in and you're doing it, but you're not taking the exam at the end of each section. So I'm unable to put a grade. So you might see that it's a 0 now, but it will not be a 0 once I go in and you take that quiz. Your grades will be updated. So I don't want anyone to think that I'm not grading their labs. It's just that you have to do that quiz at the end, because I'm seeing that quite a few of you all are doing the labs, but you're not taking the quiz. So do you see the quiz, Miss Ashley, Misty, and Samara? Do you all see the quiz after each assignment?
On the
in your SimChart simulation?
yeah.
Are you seeing it, Samara? So even though if you submit those assignments and you're not taking that quiz, it will not allow me to give a grade. So even if you're doing them, and some of the quizzes are like 5 questions, some might be 10, some might be 3. If you don't submit that quiz, even though you might have a 60 on that quiz, I'm still giving you the full credit for that assignment. But at the end, I have to average those grades that's in your SimChart to get your final grade for this module. In module 157, I want you all to understand, module 157 is no longer the playground. It's the actual chart. So please play around. That's why it's called Simulation Playground. Please get as much practice as possible as you can in that simulation playground to understand it. Use your book to look at the patients they have. The quiz is just to let you know too if you're getting the information correct or not, but make sure that you're playing around in it. That's what it's there for, because module 157 is strictly the actual sim chart. And you will not be able to go back in and make those corrections like you're able to play around and look at all the different charts that we're doing now. So I just want to make sure that I'm stressing that to you all so that you all won't be shocked when it comes time to the real thing. And you're like, I don't know what I'm doing. So please make sure that you're reading your PowerPoint slides. The PowerPoint slides, which we're going to go over now, breaks everything down. If you're having difficulty with reading it in the chapters, it breaks everything down for you. Also, remember those key terms. On your exam, you will have those key terms that you will need to know. And this is going to be very beneficial for you when you're actually in the field. You're going to have to know those key terms. The doctor and whoever's charged, they're not going to write out that whole word. They're going to have those acronyms, you know, abbreviations, all of that you have to be familiar with. So pay attention to those key terms when you have those assignments. Pay attention to what's going on. Remember, read your news and announcements. I had several people emailing me, texting me about where to find the Zoom class. And I state every time when we have these classes, the Zoom class link is in the grade section of e-learning. It's in the grade section of e-learning, and your NCCT prep link is in the grade section of e-learning as well. That was posted in there as well. So every time when they have the 2 o'clock Zoom class, that will be placed in the e-learning section. It's labeled NCCT. So I'm going to share my screen so I can show you all again. Because quite a few people are asking me where things are, and that's showing me too that you're not watching the videos. So right here, you have the welcome. Well, I'm gonna go down to where everything really is, where you all would need to see it. Here is a sim chart launch. Here's the syllabus, and you can always check your syllabus to find out what we're actually covering in that chapter, which I do post in your assignments, your objectives, so that you wouldn't have to go back to look at the syllabus to see what objectives we're covering. You have your grade book, your attendance. On here, it states this is where your sim chart launch is. Somebody asked me where that was as well, and we've been in this class now for over a week. Your Zoom class. This is your Zoom class. I'm gonna click on here. When you click on Zoom class, here are where the assignments, when we have our Zoom class, it's posted right here in Zoom class. So you can always go back and review everything that we covered when you click that link, Zoom class. NCCT. Well, another thing, the PowerPoint slides are right here. When you click on PowerPoint slides for that chapter, you just click on that chapter, you'll find the PowerPoint slides. Next, we have the NCCT link. This is the NCCT prep link, so you can log on to the class, but then on this link is the actual class that we had on Tuesday. Remember, the NCCT class is everything. We do each section on what will be on your certification exam. This is very important because it's the actual questions and things that will be on that exam. Remember, your NCCT certification exam is multiple choice. The entire exam is multiple choice. So the certification that we do to practice is just giving you helpful information on what will be on that exam, a study guide. So all of your information is here. So what we're going to do now on your exam, your exam is going to be on chapters 3 and 4, which is tomorrow, and you have until Sunday to complete it. So we're just going to go over a quick, because this is not going to be as long. We're just going to go a quick review, and I'm going to use the PowerPoint slides, because that's where your exam is basically coming from. So if you're reading and reviewing your PowerPoint slides, you shouldn't have a problem with passing this exam. So on here, we have chapters 1, chapters 2, chapter 3. We're doing chapters 3 and 4. I'm just doing a quick review. Privacy, confidentiality, and security. Also remember, like the questions that's in your daily assignments, those assignments are pulled from questions that will be on your exam. So it's like I'm giving you all the possible information I can give, but I can't read it for you. You have to read the information. So on here, it says, here are your learning objectives. So if you don't want to look at the syllabus, when you look at your PowerPoint slides, your objectives for this chapter, it's here. Confidentiality and security. Explore the history and scope of HIPAA. Discuss the legal meanings of privacy and confidentiality. Another tip that I'm going to give you all. When you look at these objectives, and then when you get into your actual slides, it goes step by step over the objectives that you have. For instance, explore the history and scope of HIPAA. After it covers the objectives, it's going to tell you right here, the objective, Health Insurance Portability Act and Accountability Act, HIPAA, HIPAA. Every class you're going to be having this all the time, HIPAA, Health Insurance Portability and Accountability. Several people had this wrong on the last exam. Several. It tells you here, HIPAA, because you know what usually happens? You see it might have HPIAA and you're just rushing through it and you're not actually paying attention and you mark the wrong answer. Health Insurance Portability and Accountability Act, HIPAA, which stands for the privacy rule, security rule, portability of insurance. It goes through objectives. The next thing it states, what is privacy? It's breaking it down step by step. What is privacy? Ethics, laws, privacy. Set of the rules and standards of conduct that grow out of our shared understanding of right and wrong and govern our professional behavior. This is on your exam. What is privacy? Laws. Formal enforceable rules and policies based on community standards of conduct. Another hint, when you're taking your exam, it's online. You have your book, your PowerPoint slides, you have everything that you would need to pass your exam. So when you don't pass this exam, it's because you're not reading. And you can have, when you're doing your exam, your PowerPoint slides are there, and basically everything on your exam is in your PowerPoint slides. And I'm going to show you another helpful hint. It's in the summary of that chapter. So we're not just pulling out questions from another chapter. Everything that you're covering is in that section. Privacy. What is privacy? Patient's freedom to determine when, how much, and under what circumstances his or her medical information may disclose. This was a daily assignment and several people had this wrong. I don't understand how. Privacy, this is in your book, it's in the PowerPoint slides. What is privacy? Privacy, patient's freedom to determine when, how much, and under what circumstances his or her medical information may be disclosed. Confidential versus anonymous. Here are the definitions right here. Confidentiality refers to how the recipient of the information handles information that a patient does not wish to share. Anonymity. Information cannot be linked back to the patient. People are getting this wrong in the daily assignments. I cannot stress enough. I do read everything. I do read everything. So please don't just put something and think, oh, you can purport and I'm not going to read it. I do read all of your answers because you have to realize this information is crucial. When it comes to that certification exam, I don't want you thinking that you have an answer right and I'm just marking it right and then you have it wrong. That's not going to help you when it comes time to taking your certification exam. So I want you to have the correct information. Privacy rule. It establishes privacy standards for use of individually identifiable health information. Helps patients control ways that their health information is disclosed. Requires disclosure of health information to be law. This is on your exam. What are the privacy rules? So when I'm giving you this and you go back to review, you should be making highlights. You should be highlighting information in your books, on your PowerPoint slides, and then when you see that question on your exam, you know where you need to refer back to. Disclosure information. Patients are permitted to request a log of disclosures of their protected health information. What does PHI stand for? Protected health information, which must include the following for each disclosure. So what's included in a disclosure documentation? The date of the disclosure, the name and address, if known, of the entity or person who received the protected health information, PHI. A description of the PHI disclosed, an explanation of the purpose of the disclosure, or a copy of the patient's written authorization, a copy of a written request for a disclosure, if any. So I'm not going to have you to write all of these, but I would say, like, they'll say, like, give some examples of disclosure documentation. It might be 3 or 4. Here it is right here, disclosure documentation. Let me go back. Here are all of the disclosures documentation. Here's the other part. So if you have any of these, it would be graded correctly. Entities, providers are required to, so an entity or a provider, they're required to distribute notice of privacy practice. NPP stands for what? Notice of privacy practice. Designate a privacy officer, provide authorization forms for release of PHI, which in your simulation playground, you have to complete an authorization form to release PHI. Implement policies to protect PHI, develop procedures for correcting errors in the electronic health record, provide privacy training for staff. This is in your EHR when it comes to your labs. Components of an authorization form. Here are the components of an authorization form. So when you're looking to complete that authorization form, if you don't want to look in your book or you don't have your book with you, you can look at your PowerPoint slides. This is what you would need for an authorization form. The complete name, date of birth, and address of patient. Have any one of you completed your authorization form in the EHR yet? Any of you have gotten to that part? You're on mute, Ashley. You're on mute.
I want to say I started it, but I don't think I finished it.
Okay. And see if you didn't finish. So what that means, Misty, I can't give you a grade, right?
Yeah, well, I'm not finished with
Yes.
the whole thing. So.
Yes.
Yeah, I
Exactly.
think I did. I don't remember.
Right. So here though,
Trying to find information, so.
right. So when you're doing it, like here it is, here are all the steps right here. This is what needs to be completed on an authorization form. Complete name, date of birth, and address of patient, not just that first name, the complete name. A description of information to be disclosed. See, like all of this I'm showing you in the simulation playground on what you need, module 157, you're gonna have to know how to do all of this. You're not gonna have all of the information that is showing now. It's gonna say complete an authorization form. So you still will have your information for you to reference, but it's not gonna be like it's set up here because you're just getting into it as practice. So module 157, when you look in that chapter, you're gonna have to go back because it's gonna say complete this authorization form and you're gonna have a time limit. So you have to realize when you start working, you're not gonna be able to spend 2 and 3 hours or 1 and 2 hours on completing the authorization form. So the first thing it is, like I said, complete name, date of birth, and address of patient, a description of information to be disclosed, a description of information that may not be disclosed, name of individuals provided information, list of individuals or entities to whom information may be disclosed, date when disclosure expires. You always have to have a date when it's going to expire. You just can't have it open and not state because it has to be an expiration date. Statement information, patient that authorization may be revoked if he or she changes his or her mind. They have that right to change their mind. Notice advising patient that information disclosed could be redisclosed and no longer be protected. Patient's signature and date signed. Covered entities and business associates. These are the covered entities and business associates. Healthcare provider, health plan, and the healthcare clearinghouse. So then we had our safeguards, minimum necessary standard. When a covered entity makes an allowed disclosure, it should include only a minimum necessary amount of information to be accomplished to accomplish the purpose. So when you have that minimum necessary standard, you don't have to tell everything that's going on. You only answer the question that was asked. Don't provide any additional information. Only provide what's being asked of you. This is important here. Authorization versus consent. You have an individual choice principle. Patients should have a reasonable opportunity to make informed decisions about the collection, use, and disclosure of their, what does PHI stand for?
Protective health. Oh, God.
One more word.
Information.
Yes.
Oh.
Right. So you see how they have this here, PHI? They're not going to have protected health information when you see that documentation. So you're going to have to know what that PHI stands for, which is protected health information. When you get in my module 157, I'm trying to prepare you all. Module 157, you're not going to see all of those words spelled out and everything in there. They're going to have all of these acronyms and abbreviations that you're going to have to put into these charts. For records to be released, an authorization form must be completed. You cannot just because they come in and ask, oh, I need this. You have to have an authorization form, must be completed first. HIPAA privacy rule permits but does not require covered entities to voluntarily obtain patient consent for uses and disclosures of PHI for treatment, payment, and operations. That will be on a need-to-know basis. The security rule. The HIPAA security rule gives each covered entity 4 broad goals to meet. This is on your exam. The HIPAA security rule gives each covered entity 4 broad goals to meet. Protect the integrity and confidentiality of electronic healthcare information created, received, maintained, or transmitted. Shield against anticipated security threats. Shelter PHI against unauthorized use and disclosure. Ensure that all employees comply with the provisions of the security rule. That's very important. Security safeguards in the medical practice, designed to avert security breaches, provide contingency plans. Safeguards fall into 3 areas: administrative, physical, and technical. This was a daily assignment question. Security safeguards in the medical practice. Safeguards fall into 3 areas: administrative, physical, and technical. So this was a daily assignment, so I'm not going to go through this again because you already have read this. The administrative, the physical, and the technical. Assigning employee privileges, make sure you read through that. Patient rights under HIPAA. This is on your exam. Patient rights under HIPAA. View or receive copies of your health record. This is the patient's right under HIPAA. Have inaccurate health information corrected. Receive NPP. Opt out of sharing certain information. Have certain information withheld from certain payers. Receive a list of disclosures. File a complaint. This is the patient's rights under HIPAA. Organizations aimed at securing EHR systems. These are the systems. These are the organizations that's aimed at securing the electronic health record systems. EHR stands for Electronic Health Record. You need to know this. Access to protected health information. These people have access to PHI, financial institutions, government agencies. I'm probably going to ask for, give me 4 or 5 of these, but you need to know them. Financial institutions, government agencies, consumer reporting agencies, medical information bureau, prescription database tools, employers, family and friends, internet communities, researchers, direct marketing firms. How patients can protect their health information. Read over this. So any questions about chapter 3, because we're going to be moving to chapter 4. Do we have any questions about chapter 3? And if you read your PowerPoint slides, you cannot go wrong. So we're going to move into chapter 4. And remember, I'm in your PowerPoint slides. Chapter 4. So remember, your objectives for chapter 4, now we're in administrative use of the electronic health record. Chapter 4 objectives, again, they're in your PowerPoint slides. Explain the importance and typical duties of the front office assistant. Discuss the necessity of respectful communication among providers, staffs, and patients when answering the telephone, confirming appointments, and taking messages. This should be some of your information that's in your daily assignments now. Role of the front office assistant. Make sure you review this. You should know the role of the front office assistant. Communication in the medical office. Good communication improves patients' confidence in their care, increases satisfaction among patients, and safeguards confidentiality. Telephone communication. This is very important. Telephone is usually the first communication between staff and patient. So that might be one of your true false questions. What is usually the first communication between staff and patient? Telephone. First impression of office, professional, positive, pleasant tone when answering. Common types of telephone calls in the medical office. Appointment requests, inquiries from prospective patients about the practice,
What crux it?
requests for medical advice from a physician or nurse, prescription refill requests, insurance and billing questions from patients, information
Yes,
requests
ma'am.
from insurance companies, questions from pharmacists, medical supply vendors, and other medical offices. So on that question for your exam, what are some common types of telephone calls in the medical office? Here it is in your PowerPoint slides. Guidelines for proper telephone etiquette. Review this. See, this is stuff here that you have to read and understand. Appointment confirmation. This is going to be in your exercises. How do you do a appointment confirmation? How do you take messages? Basic message needed for all phone messages. Name of caller, date and time of call, who the message is for, who the patient is, patient's date of birth, concise and accurate documentation of messages. For prescription refills, the medication name, pharmacy name, and pharmacy number. But when I have that question on there, what are the basic messages needed for all phone call messages? Look at the answer here. You don't have to look through the book for everything. Once you read that chapter, you can go to your PowerPoint slides. And like I said, I love PowerPoints because it, to me, when I'm just like with reading a chapter like you all do, when you go to that PowerPoint slide, it's giving you the basics. It's giving you that to the point information that you would need to know for that question. It's good to read through your chapter to get other information, but for the main point of view, what are the basic messages needed for phone call message? It's right here, and it's step by step what is needed. So that's why I always state, please read your PowerPoint slides. So see in your labs, it says compose a phone message in your SIM chart. It's telling you step by step on what you need to do. Click on the corresponding icon, but this is going to show if you know how to follow directions, because it's telling you step by step. And of course, you're going to make errors because you're just getting into this. But only thing you do, you have an error, you go back and make the corrections. That's it. Do not become discouraged. Just make sure that you go step by step, because I had somebody saying, I'm doing everything right. And then when we went through it, she didn't click the patient search button. So it's telling you click on the correspondence icon, select phone message template from the left info panel. Click the patient search button, assign the phone message to the correct patient. So if you assign it to the wrong patient, if they're giving you the patient and you assign it to the wrong patient, it's going to be marked wrong. When you're looking at the assignment, it has the patient that's attached to that assignment. So don't do Nassar with Miss Nancy. It's going to be wrong because you have the wrong patient, which goes back to billing and coding. If you're not paying attention and documenting correctly, you're going to bill someone else's insurance, which is a serious error. So they're giving you that patient name that correlates to this assignment. So make sure you're using the correct information. It says confirm the auto-populated details and enter any necessary information based on the phone call. Click the Save to Patient Record button. Patient correspondence, you have this in your labs. Referral letters, patient letters, emails, phone messages. This increases satisfaction and understanding among patients. Safeguard confidentiality. You have your physician referrals. Then it shows you here, patient letter, new patient's welcome letter, appointment reminder. And each section is going to tell you what you need to do. Securing email, faxing, guidelines for faxes, certificate to return to work or school, releasing patient information, incident reports, managing electronic health records, eliminating duplicate charts. So this is what you would, you have to make sure you have this. Ask whether the patient has ever been seen by the practice before. If so, use the already established patient EHR, electronic health record. This reduces for having 2 and 3 charts on that same patient because you didn't ask this question. Ask established patients if they have had a name change. This is common. So it might be Elizabeth Turner, but they got married and they updated the information. So now it's Elizabeth Williams. So you have to ask these questions, and this eliminates duplicate charts for that same person, just a name change. Always set up the patient EHR account using the name listed on the insurance card. So say she changed her name to Elizabeth Williams, but on her insurance card, it says still Elizabeth Turner. You have to use Elizabeth Turner. Even though they say, oh, that's not my name anymore. Well, guess what? In a kind, nice tone, you'll have to let them know, please contact the insurance carrier to update your information for your name change. Because if you submit Elizabeth Williams and on that insurance card, Elizabeth Turner, that claim is going to be denied. So please make sure that you're always informing that, especially for billing and coding. It happens so often and that claim is denied. So that company, that doctor, you're losing money. And so it's going to take probably another 30 to 45 days to have that resubmission, which is still holding up that company being paid for that service they have provided because of a question you didn't ask. And a lot of times what happens, you just take that information, they're making a copy of it, they don't ask any questions. That's an error because now that company is not being paid and serves, the billing is being delayed. Purging patient records. Patient health records are classified into 3 groups. Test question. Patient health records are classified into, might be a true, false. I might say patient health records are classified into two groups, true or false. That's going to be false because it's 3. And the 3 records are it's active, inactive, and closed. This was a daily assignment question as well. Patient health records are classified into 3 groups, and the 3 groups are active, inactive, and closed. Then they have the retention period and then the purging. Process of separating inactive and closed patient health records from those that are active. Integrated devices, back up the electronic health record. You have your calendar, calendar views, all of that is in the window pane, the panel. Then you have your 3 types of appointments. Patient, block, which is holiday, lunch hour travel, other, staff meetings, vendor meetings. 3 types of appointments, patient, block, and other. It tells you how to block an appointment time. It tells you what to do for double booking. Any questions? So you see chapters 3 and 4 is basically reading the information, reading in your chapter, going into the simulation playground, practicing with the charts, playing with those icons, going back and forth through them with scheduling an appointment. Everything is in your book. So now I'm going to show you in the book right quick before we log off for today. On your assignments. So here are the objectives. Make sure here are your key terms. Make sure that you're reviewing your key terms. Everything we just went through in the PowerPoint slides, here it is here. health insurance portability, confidentiality versus privacy, everything that we covered. But I want to show you where your assignments are. Trends and applications, 3.1. They're asking you questions. Read the information. They give it good examples. Privacy rule. And then it's showing you here is a detailed job description of a privacy official in a healthcare facility. Read over those brochures and information that they're showing you. EHR exercise 3.1, disclosure authorization. Complete the following exercise in EHR exercise found in the info panel. It's showing you where to go. You're going to find the disclosure authorization in your simulation playground in the info panel. It tells you where Walden Martin Family Medical Clinic has been asked to participate in a stroke prevention study conducted by the Heart Wellness and Research Group. Is giving you all of this information that you need to put into that chart. 345 Vascular Lane, Anytown, AL is giving you Dr. Martin's page. So it's giving you everything that you would need to document. So look, it shows you here. It's telling you what to do. Click on the form repository icon and then select the disclosure authorization from the left info panel. Use the patient search button to link the document to the patient record before proceeding. So if you don't do this step correct, you're not going to be able to have it correct. Fill in the blank text fields and save the completed document to the patient record using the Save to Patient Record button. This information right here is giving you all the information. It's giving you the date of birth, the address, the patient's name. They're telling you where you need to go to complete the exercise. This is going to show if you know how to follow directions. This is what you will be doing in billing and coding. Next, critical thinking exercise 3.2. Mr. Rogers, a letter carrier from the U.S. Postal Service, is being seen in the healthcare facility because he was bitten on the ankle by a Yorkshire Terrier and the ankle has become infected. Mr. Rogers' provider and medical assistant are discussing the patient's condition and history outside of the examination room. Mr. Elderman is heading toward the reception desk and overhears the entire conversation, including the somewhat embarrassing story of how Mr. Rogers lost a fingertip 8 years ago after offering a leftover chicken nugget to a Cocker Spaniel on his route. Have the provider and medical assistant violated the HIPAA privacy rule? What do you all think?
Yes.
Yes, and why?
The reason being is because you're not supposed to discuss anything about a patient in front of them.
Right. And then, like I said, that's confidentiality. You shouldn't be in a hallway discussing anything with anybody.
Right.
You know, because you never know who's out there listening, and then it spreads to this person, then it spreads to that next person. So that's a violation of the HIPAA privacy rule. So then they have on here, it gives you again, and see how it's much better for you all in the PowerPoint slides. On here, this is the covered entities, but you see how it was when we did the PowerPoint slides for the covered entities? On here, it says a healthcare provider, a health plan, a healthcare clearinghouse. This is giving you examples, but in that PowerPoint slide, it makes it easier to understand. So then we have here, minimum necessary standard. Let me go back here. So on here, authorization versus consent. Then on here, it says box 3.1, components of an authorization form. And then here we go with your exercise 3.2. Authorization for the release of medical records. Complete the following exercise in EHR exercises found in the info panel. So you're always going to find your information in the info panel. Chase Murray was entered into SIM chart for the medical office as a new patient in chapter 2. So you see how it's going to keep referencing back to what you have already should have covered. It says in chapter 2, he was already entered as a new patient. Here is his information. Chase Murray, date of birth, 4/7/1993, is a new patient of Dr. Walden. Before his first visit, the provider would like to review all of Chase records from 2010 to the present date from Dr. Marion Brown, his previous primary care physician. The medical records release will expire in 90 days or immediately after the records request is complete. Remember when I showed you in the PowerPoint slides, you have to have an expiration date. It can't just be ongoing. You have to have an expiration date. So in 90 days, that consent for the other doctor's information will expire. Dr. Marion Brown's office is located at Medical Arts Building, Suite 3B, Anytown, AL 12345. Dr. Brown's office phone number, they're giving you all the information and the facts. The record should be sent to Walden Martin Family's Medical Clinic, the address, Walden's Martin phone number, they're giving that, and the fax number. Prepare a medical record release for the patient's signature. Here it is. Click on the form repository icon and then select the medical records release from the left info panel. Use the patient search button to link the document to the patient record before proceeding. So before you do anything, you're gonna use the search button to find that patient. Fill in the blank text fields and save the completed document to the patient record using the Save to Patient record button. So it's telling you, so you have to go back, you have to go into that search panel and put that patient's name. So if you did that information prior and you have it in, all of that patient's information should come up. And then it's going to tell you what you need to do in filling that information. From here, it's giving you the information. This is what you're going to be doing when you're reading a record. You have to put the information that's provided for you into that chart. And so with each exercise, the information is before, and then they give you an exercise to complete that information once they've explained. Tips for choosing a strong password. They give you that information. And here we go with the same critical thinking exercise 3. Name several situations in which it would be dangerous for the patient if a key piece of his or her health information were changed or deleted, either intentionally or inadvertently. One of your exercises. So this is why it's important to make sure you read, and each chapter is going to relate back to a previous chapter just to make sure that you're understanding what you're doing. And that's why I'm saying play as much as possible in that simulation playground. Don't get discouraged when you're getting something wrong and you feel that, oh, I made a 40 or 50 or 70. This is for you just to get that extra practice. Go back and just redo it. Make sure that you're following the instructions that's in that info panel. Everything they're telling you, notice of privacy practice, NPP, notice of privacy practice, and patient's bill of rights. Here it tells you again, look, everything is saying. Now. Complete the following. It's telling you as a new patient in chapter 2. So you should have already had that patient in that EHR already. So now you're going on to the next step. So I will be opening up more simulations, more exercises for you to complete, but I wanted you to get a hang of it. That's why I just did that 1 through 20 for you all just to get that extra practice, but I will be opening up more because you have 99 of them. to complete.
I
And it's
guess I
for
need to start
practice.
on mine.
I'm sorry, Misty, I didn't hear you.
I guess I need to start on mine.
Misty, you haven't started
Not the not the
labs?
sim one. Yeah. No, I started my labs.
You're talking about the sim chart exercises.
Yeah.
Yes.
I've done 2 of them.
Well, I'm sorry. You have quite a few to do, Misty. Have you started any,
no.
Ashley?
Yeah, I think I did 3. It's just I've been focusing like on all my labs and my daily question every day. So I'm gonna try to do it on the weekend. That way I can sit there, have all my stuff done, and then I can just go in and
Yes.
I'm trying.
But remember, but you see how everything links back and it's telling you, it's giving you all of the information, and you're going to have the book because you need the date of birth. You need what they're there for. So all of this, you have to complete. That's why I said I gave y'all time. You don't have to do everything. As long as you're doing a lab, you have time to complete it. But module 157 is totally different. You have to know the information, what button you need to press, where to look for the information. This is just preparing you for that next module. And remember, it's only 20 days in this module.
Oh.
And next week we're on day 13.
Oh my gosh.
Yeah.
Well, I'll be doing it this weekend for sure.
So we're on day 13 starting on Monday.
Oh my gosh.
It's only 7 chapters in this module, and we're already taking your exam for chapters 3 and 4.
Okay, yeah.
The last exam is chapters 5, 6, and 7. You're going to have 3 exams together.
Oh my goodness. Okay.
I'm gonna hide now.
So start working on those sim chart playground simulations.
Okay.
So
Yes,
you all have a great and safe and happy weekend. Remember, your exam is tomorrow, Friday, chapters 3 and 4, and you will have until Sunday to complete it. So just make sure that you review those PowerPoint slides, review this video. If you have any questions or concerns, look at the videos. Go back and look at the previous videos. Everything is in the Zoom classroom. If you have any questions, one thing I want to mention, if you have any questions or you need to schedule a one-on-one, or if you're having difficulty, make sure you email, text, or give me a call. When you all are calling me, like at 8:30 and 9 o'clock, if I'm not busy, I will answer. But my office hours are 8 a.m. to 5 p.m. Monday through Thursdays, 4 p.m. on Fridays. I will have a class with you at 8 o'clock, or 8:30, but I have to have it scheduled. Because remember, I have 6 classes I'm teaching, not just I have independent study classes as well. So I might be on a class session with another student when you're calling me, and I don't want you to think that I'm not answering or responding, but that's why I say, please email, text me, or schedule with me so I'll have that time set aside to give you the time that you need to make sure that you understand what's going on. So I don't want anybody to think that I'm ignoring them, but I have to have a schedule. I just can't answer and then just think that, I can just get on at that time, because I do have a lot of students who are scheduling times, and I don't want to impede on their time as well. So just remember to make sure that you email me, text, or call me, and I'll let you know if I'm available at that time. But make sure that you're getting these simulation playground activities done. Make sure that you're responding to emails, you're reading emails, you're looking at your news and announcements when you log on and before you log off for today. You're checking your emails if I'm sending you something, and you're looking at your NCCT videos, you're looking at your Zoom class videos. The information is there for you, but you have to be willing to read and look at it. So again, you all have a great weekend. Any questions, reach out, and I'll see you all on next week. Enjoy your weekend. Bye-bye.